Welcome in everybody to our Aspire video series, focusing this time on medical careers. And we have a fantastic guest today talking about the work as a certified surgical technologist. Maybe that's a job you've heard about, maybe not. Maybe it's something new that you're curious about. And so we're going to learn all about the job today with our special guest, and I'll have her introduce yourself. So please provide your name and your title and a little bit about what you do.
Yep, my name is Melissa Jensen. I am currently a certified surgical technologist. I've been practicing for almost about a little 2.5 years now. I absolutely love it. Not all days are easy, but that's still so much fun.
So the first question, which I'm sure students are wondering, is what is a certified surgical technologist?
So a lot of people know of nurses, but not a lot of people hear about surgical technologists. We are basically the surgeon's right-hand mans before surgery and during surgery. We're the ones we prep the operating room. We gather all the supplies, make sure we have everything they need, and then we set up everything for surgery. All the instruments, all the tools, everything that they could possibly need during surgery, that is us. And then while they're operating, we are the ones next to them, the whole case.
Wow. So let's help the students visualize. Tell us where you work. Tell us where you are in the country, where you work, what kind of hospital it is, and the kind of surgeries that you do.
Yep. So I'm in Northern Illinois, Rockford, Illinois, and I'm actually at a surgery center. So we do some cases similar at the hospital,
Okay.
but we are faster paced, and then we don't see like hearts and neurosurgery. But I do ophthalmology cases, so cataracts. I do oculoplastics cases, so that has to do with the eyelids or maybe some reconstruction after cancer on the face. We do general surgery cases, so that could be hernias or removing a
Mhm.
gallbladder. We do plastic surgery, so tummy tucks and liposuction. Um, One of my favorites is I help in pain management and I help place spinal cord stimulators with my pain management docs.
Wow.
So we do almost every specialty. Another favorite specialty is podiatry. I love helping people get their feet back to normal. It's amazing.
Why do you love that so much?
It's not only cosmetic, but my doctors are really great, which is something you want as a surgical tech. You build that relationship and, you're really helping a patient get their quality of life back. People don't realize how important the feet are. And these people come in and they're in so much pain and they can't do their everyday life. And then we're there next to the surgeons helping these patients get back to a great quality of life.
It sounds like you're helping with surgeries all across the spectrum.
Yes.
Face, feet, gallbladders. I mean, is that to be expected in this role that you should have a broad understanding of the tools and the process for any kind of surgery?
Yeah, so the really great thing about this profession is, yeah, you can go from the scalp to the toes in one day and do anything. If you're at a hospital, sometimes people do specialize, say they just do hearts or they just do orthopedic surgery. But when we are trained, and a lot of times we spend a few years doing just about anything you could think of, an
Wow.
eyeball, a finger, a toe, a stomach, a brain.
Wow. You
Yeah.
must have to retain a lot of knowledge about a lot of different body parts and a lot of different, because every surgery is so different, right? In
Every
terms of
surgery is different.
like how much, like I have a friend who was a heart surgeon. And so I know many of his surgeries can last hours.
Yep.
And so do you find yourself in the operating room for hours and hours some days? Do you skip a meal? Do you have to like, how does your day work? What is it like?
Yeah, so we start really early in the morning, about 6:30 is when you get to the hospital. You have to get changed, you have to cover, your hair, you get changed into hospital administered scrubs. Then you usually are in the OR about 6:30, 6:45. You have to go through all your supplies for the case. So say it's a heart, that's a lot of supplies and a lot of instruments. You have to make sure you have everything that you can need for your surgeon for the case, just in case an emergency happens. And then you have to open all those supplies. Usually we have help from the nurses doing that. And then after everything is open, we as a surgical technologist set up everything and organize everything in a sense that, is just organization throughout the surgery. And we usually have extra stuff, like I said, if an emergency happens. Hearts are actually one of my favorites. So I've had the opportunity during a coronary artery bypass where I actually get to hold the heart while the
Wow.
surgeon is sewing. Yeah, it's incredible.
Whoa. Okay, that was another question. Help the students understand you're in the operating room, you're bringing all the tools, the necessary equipment ahead of time. What are you doing during surgery?
During surgery, we are right next to the surgeons the whole time. If they need local anesthetic medication, we're the ones getting that to the doctors. We have all the instruments that they need. If they're sewing, we have the suture. But basically, during every single surgery, we're at their side for whatever they need.
Wow. So this brings up the point that we like to stress in our videos about the importance of strong communication skills.
Yep.
So how do you use communication skills in your job, especially when you're in the middle of surgery? What does it mean for you to be a good communicator?
Communication is definitely key in the OR. It's huge, and everybody has a different way of communicating. So you got to kind of adapt to all personalities and can't just think that one person communicates the same way you do. So really communication, a huge one is reading your room and figuring out your
Hmm.
doctor. And,
Give me an example of that. Like what does it mean to sort of read the room or understand which particular doctor you're with? What does that mean?
they all have certain specifics that they like, or, you can kind of tell with their personality, when we're the ones that gown them and put their gloves on, and you can kind of, I always say good morning and everything. And you can kind of, is this case going to be difficult? You can kind of tell that, from the beginning, which, I mean, we're always serious during surgery, but, they kind of can give you, if you can read them, a heads up to how the case is going to go.
Hmm.
And, just while you're operating, the communication with them is just needs to be clear and concise, because you could have an accident, you could have a medication accident if you're not communicating with them correctly, you know.
Yeah. And that's when we talk to students a lot about it's okay to ask questions if you're not sure, instead of being
Yes.
afraid to look silly. Like in your line of work, you have to be absolutely certain of what they're asking you for. You can't just do it if there's any doubt. Do you find yourself sometimes asking, like, I just want to confirm with you, is this what you said or is this what you want? Do you find yourself doing that?
Yes. And you can't be afraid to, like you said, ask questions. I'd rather say, I'm sorry, can you repeat that? Or I'm sorry, is this what you wanted? Instead of maybe handing him the wrong medication or handing him the wrong instrument. So,
Absolutely.
yeah.
Yeah, I mean, you can't really take chances. Not every job is this sensitive and serious in terms of like
Hmm.
the human life or human
Yeah,
body, but
absolutely.
but
Yes.
especially in your case, you can't take any chances with information going back and forth. So, what type of schooling, what type of education is required to do your job? Tell us your educational history.
Yep, I have an associate's degree in science and surgical technology. And then once you complete your 2 years associate, we have a accrediting body that you get your individual certification through, that basically shows you went through an accredited program. And yeah, we have a whole association of surgical technologists. It's basically the top tier certification that you would want to achieve as a surg tech.
So what's that program like? Talk about how intense it is.
Mhm.
What's like is there a ton of work? Is it stressful? Is it hands on? Like what was that training like?
Yeah, so it is a mixture of book work and then you get hands-on. So when your book work, you're heavy anatomy, pharmacology, um, all the things, chemistry, biology. And once you get past the book work, my program was hands-on and book work at the same time. So I would have online lectures still about a specific specialty per se, and then I would have hands-on lab, where you're learning all sorts of different instrumentation, how to set up for different surgeries, different equipment. And then once you're prepared enough in the lab, then you actually physically go to your clinical sites, so hospitals and surgery centers. And that's when you are hands-on in surgeries themselves and you start working with the surgeons and the nurses and the other surgical technologist staff.
Mm. How many surgical, like, are you the only surgical tech in the operating room most days, or are there more than one of you?
Yeah, most days there's just one of us in there. We do have surgical assistants too, but most times it's a surgical technologist in the room. Sometimes if the surgeons need an extra hand to hold a camera or so, we might have a surgical tech join, but usually there's one of us and then the surgeon.
And we've actually, in a separate interview, we've talked to a surgical assistant, but
Mm-hmm.
help the students understand what is the difference between a surgical tech and a surgical assistant.
Yeah, so a surgical assistant will kind of stand across from the surgeons most time. They may help with suturing or suctioning at the field, maybe retracting while we are still manning all the instruments that they need, all the medication, basically everything they need. And a lot of times we will join in on retracting and hands-on too. So,
Okay, so you're allowed to be much more hands-on with the patient and with the tools because of your training, and they're more like
yes.
there for assistance, but it's just not as involved.
Not
It's
with the instrumentation per se. We will run the instrumentation as a surgical tech, and they're mostly kind of just hands-on at the incision
I see,
site.
I see.
Whereas, yeah, we're doing all the tools and equipment and
Okay, okay. And what's your schedule like? Or do you work like 3 days in a row, have days off? Is it like heavy like that, where it's more like
Mhm.
chunks of time?
So I work a super sweet 6:30 to 3. No weekends, no holidays, no call. I'm at a surgery center, but it can
6:30 to
vary.
3. How many days a
Yeah,
week?
5.
Oh,
So
wow.
I'm eight
Every day, 6:30 to
every
3, but
day.
no weekends, no nights.
Nope, and no call. So that's all at the hospital where, you can get varying shifts. I've worked 6:45 to 3:30 at the hospital before, and then they have all different call schedules, and you can have a mid shift and night shift, and there's just all sorts of things at the hospital. But right now I'm 5'8", 6:30 to 3.
So this is important for students to know because when they
Yeah.
think, oh, you help with surgery, they think the only place that could ever happen is a hospital. That was even how
No.
when I came into this. I'm assuming you're at a hospital and you're at a surgery center. Now, is it like owned by a private company, not
Yes.
affiliated with a hospital?
No, we're private, but a lot of the hospital doctors from the area come to our surgery center. So I still get to work with a lot of the hospital docs. And then I would say maybe about half of them are private practice doctors as well.
So how does that work? Not to get too technical about it, but these
Yeah.
doctors work for a hospital at a hospital. They also work where you are. They're also private practice. So they just sort of like float around and do surgeries as needed in the community, and they just kind of go where they surgery needs to take place.
Yeah. So I know a lot of docs based off patient's insurance or just what is better for the patient will kind of group some surgeries maybe at the surgery center. And then, if it's a sicker patient or there's some sort of bad disease involved, that's the patients they'll take to the hospital.
Okay, I see. So it's just good for students to know not only that this job exists, but also where it can happen.
Yeah. And
Because
the
I think,
other thing,
yeah, go ahead. I'm sorry.
you can also be private practice surgical tech. So you can actually follow your surgeon. Sometimes you'll be in the office with them, maybe doing smaller procedures, and then you'll either follow them to the hospital or a surgery center, wherever they are.
Hmm. Okay. So it seems like this is a fairly in-demand occupation, right? I mean, if you go through the training, you're going to have a job. Does that
Oh,
seem
yeah,
like the case?
absolutely.
Yeah.
Absolutely. Yes.
Okay.
Yes. Surgery
And
never stops.
that's right. That's right. And I know through my friend that
Yeah.
his team has been short-staffed for months. They
Hmm.
don't surgical techs, surgical assistants, like there's a shortage of
Yes.
them, and it hurts their surgery schedule when they don't have
Hmm.
enough people for these surgeries. So I know just from where we are in Virginia that it's a problem. So it must be other places
Yeah.
too. For students watching this, what would you suggest they should be taking in high school, to like the types of courses or clubs or extracurriculars? What would be a good way to train for this line of work?
Yep. So definitely, like I said earlier, heavy on the sciences and get into the anatomy classes. Biology is a big one and chemistry, but anatomy is the biggest one I can stress. And then as a student, we do have in Illinois state, well, I'm in Illinois, so each state has their own student assembly as well. When I was a student, I was involved in it, gives you the opportunity to not only mingle with other surgical technologists, but scholarship opportunities as well, which then leads to, jobs and all the great things.
Wow, that's great for students to hear. Now, students often like to say, like, what's the most difficult part of the job? What's the most rewarding part of the job? Let's start kind of wrap up on those kind of things. Like, what's the most difficult part of your job?
Difficult is, I would say, personalities in the OR. And no day is the same and no case is the same. So, you could think it's going to be a routine surgery and an emergency happened, your patient code's on the table and, it's not what you expected for the day or,
Mm,
something goes wrong. But that's where as you get more comfortable in the career, how to stay calm and what your role is as a surgical tech when emergencies happen in the OR.
wow. And on the other side, what would you say is the most rewarding part of your job?
Uh, for me, everything. But I really love my team and my coworkers. That relationship you build with other technologists and the nurses. The best is with the doctors. It's just this beautiful dance that we do. They come into the OR and you're ready for them, and it's almost like you just learn them. They don't even need to say what they need, and you just are thinking with them while the procedure is happening.
I like that. And that speaks to the soft skills of anticipating,
Yes.
reading their mind,
Yes.
already being like one step ahead, knowing their personality. These are things that are very hard to teach. And
Yes.
you have to kind of just get in the environment to learn, right? I
Mm-hmm.
mean, it's like it's hard to teach that in an exam,
Yep.
have
Yeah,
how
it
to
is.
read people and feel the room. So, are there opportunities even in your surgery center for students to come and observe or shadow or help in any way?
Yeah, we've had students come through before. A lot of times they will observe just maybe their first day or so. And then when you're a student, we have to meet a certain amount of cases in different specialties. So then once they're comfortable enough and they want to start getting more hands-on, then, they're allowed to start setting up and passing to the doctor and
Hmm.
assisting in the surgeries.
That's cool. That's good to know.
Yeah.
So if a student's seeing this, they could reach out to a surgical center or a hospital in their community and ask if it's possible to get that kind of hands-on experience, which
Yeah. And
yeah, go ahead.
actually, when I was in school, before or when I was just starting my program, I had reached out to the hospital and say, "Hey, I'm starting this program. Can I come spend a day observing?" And they were great about it. And I got to stay in surgery all day and
Wow.
observe. So,
Well, that's
yeah.
the way to find out if you like it or not, right? I mean, you have to be in the environment to say, well, this is for me, or I can't stand the sight of blood, so I'm never going to be able to
Yeah.
do this, or it's you have to get in the environment to truly understand. So that's
Yes.
good to know that it's available to
Mhm.
students if they really want to pursue it. I'm sure
Yep.
it's not going to give itself up easily. You got to work for it.
No.
You
Yeah.
got to really, be intentional, but it's there. So,
Yes.
any final thoughts about surgical techs for the students out there?
I think it's a great career. There's so much learn. You learn every day. You never stop learning. There's so many opportunities out there. I just think it's wonderful. I've had a great experience in this past 2.5 years. would never change my career. I think students are the future, and
Right.
I think it's wonderful. So
Would you, you don't have to give exact dollar amount, but would you say the pay is competitive coming out of your program just a couple of years in relative to
yeah,
other roles in the field?
yeah, I would say my pay, just where I'm at in my center, my surgery center, I'm very happy with my pay. Again, it differs from hospitals and areas around the country, but yeah, I'm very happy with my
Great,
pay. So
great. That's good for students to hear too. Okay, well, thank you again for your time and teaching us about your job. We appreciate it. And I know the students who are interested in medical occupations have learned a lot today. So we appreciate your time and we hope that you continue to excel in the early stages of your career. So thank you, Melissa.
yeah, thank you so much for having me.